Hi, everyone. Good afternoon. Thank you guys for joining us. We're here going live with some of our awesome nursing leaders from our Ochsner Baptist campus, as well as some of our Med-Surg nurses. And then we also have a representative from Talent Acquisition, Courtney Adams, who's going to be with us today to talk about all of the great career opportunities at Baptist. Our overall goal of this live talent talk is to cover the culture of nursing that we have at our Baptist campus, as well as some of the current opportunities open and the overall specialty and patient care given on a Med-Surg nursing unit. So thanks again for joining. My name is Morgan Faldo. I'm the manager of the career outreach team, and I'm excited to be here with you today as your MC as we go through some of the questions with these great panelists. I'd like to take a second to allow the panelists to introduce themselves before we get into the questions. Donna, do you want to kick us off?
Sure. Hi, Morgan, and thanks for having us. I'm Donna Martin. I'm the Chief Nursing Officer here at Ochsner Baptist. I've been here for 35 years. My background is mainly Med-Surg, ICU. I did some perioperative care, and I was lucky. I was one that came back to rebuild after Hurricane Katrina. So thank you, and I hope you enjoy our talk.
Thank you, Donna. You want to go next, McKeel, and give an introduction?
I am McKeel Swift, nurse manager of Ochsner Baptist Med-Surg 3 South. I returned to the Ochsner system in 2017 after being away for a while, but very happy to be back here at Ochsner, especially at Baptist.
Great, thank you. We're happy to have you, McKeel. You want to go ahead and introduce yourself, Lauren?
Hi, good afternoon. I'm Lauren Hayes. I'm the Med-Surg, Ochsner Baptist Med-Surg 3 Center leader. I started my journey with Ochsner in 2011 as a new grad nurse and went through critical care, pre-post-op surgical, and now Med-Surg. Thanks for having us.
Thank you. Next, you want to go ahead and introduce yourself, Gina?
Of course. Thank you, Morgan. I'm Gina Ube, and I came to Ochsner 5 years ago as a traveler. I am currently an RN supervisor operations coordinator on Med-Surg 3 Clare Center. I am a Med-Surg board certified nurse, as well as a wound ostomy nurse. And this is a wonderful 5 years that I have been here at Baptist. Thank you.
Yes, no, thank you, Gina. I appreciate that. And next, Victoria, you want to go ahead and introduce yourself?
Hi, I'm Victoria Fortes. I am an RN on 3 Clare Center. I've been here for about almost a year and a half with Ochsner and also just with nursing in general. I just graduated last year. And so far it's been a very wonderful experience, and I hope that it keeps continuing. Thank you.
Awesome. Congratulations on finishing nursing school. I know you're a year out now, but still big congratulations as you've got that year down. I'm very excited to have you with us today. And then next, you want to go, Amina?
Hi, my name is Mina Johnson. I work on 3 South. I've been a nurse, registered nurse for about a year now, and have been at Ochsner Baptist now since May. So I'm very excited to be here. It's been a great experience so far.
Great. Thank you, Amina. And then Courtney, you want to go ahead and introduce yourself as a representative from Talent Acquisition?
Yes, my name is Courtney Adams. Like Morgan said, I recruit for the Ochsner Baptist campus. So for nursing and allied, and I love partnering with our Med-Surg leaders to help them with their higher needs.
Awesome. Thank you, guys. I'm really excited to have the panel with us today and just hear your feedback on all of our questions. So we're just going to hop right into them, if you don't mind. I know during the introductions, we had a lot of discussion about 3 South and 3 Center. So Lauren, I want to start by discussing Med-Surg nursing at Baptist. How are these units structured, and how do they work together to care for our patients?
Great, yes. So Baptist Med-Surg is made up of 52 beds, 26 beds on 3 Center, 26 beds on 3 South. The 3-center unit is made up of mostly of our acute side of Med-Surg, so all of those system dysfunctions. So COPD, stroke, CHF, pneumonia, wound care, small bowel obstructions. We do get some surgical patients, cholecystectomies, small bowel obstruction repairs, but most of those surgical patients go to the 3 South unit. We are a sister unit, so we do help each other out. So if something they're used to seeing, we'll call them, they're able to help us, and vice versa. Staffing issues, we help each other out. We're there for each other. It's like we're a sister. Teamwork, it's always there.
Oh, thank you. I love that. And I know McKeel is the leader of your sister unit. So McKeel, do you kind of want to share your perspective of Med-Surg nursing at Baptist and tell us a little bit more about your unit?
Yes, 3 South is as Lauren said, a 26-bed unit. We focus on the post-surgical patient. Most of our patients are here for a short stay, like a 1 to 2 night. Mostly elective procedures. Our patients tend not to be here for chronic illnesses. They're here to have their elective procedure and hopefully get on with their lives. So we spend a lot of time focusing on post-op care, self-care, promoting independence and returning to baseline, discharge teaching and pain management. So it's a pretty fast-paced unit. Our patients don't stay very long, but it's rewarding to see people get on back with their lives. So that's what this side is about.
No, thank you for that. And it's great to see you guys working together to care for a variety of Med-Surg patients. As we talk about Med-Surg a little bit more, we often hear about nursing specialties and unit specialties. I really want to talk about Med-Surg nursing as a specialty and what that means to you guys as Med-Surg nurses. So Gina, I'm going to start with you if you kind of want to talk a little bit about your experience with Med-Surg as a specialty in nursing.
All right, sure. Med-Surg has opened many doors for me. I've had 14 years of nursing experience, and until I came to Baptist and actually worked Med-Surg, I had not utilized all the skills that were afforded me in nursing school. So coming here has opened many doors. We have such a diverse patient population that we are able to care for everything. It's really getting your money out of nursing school. Our patient population, like Lauren said, is extremely diverse. We handle a range of issues. And it's no longer a walkthrough. Med-Surg is now a specialty, and I have obtained my I'm a board certified Med-Surg nurse, and really utilize all of the skills that I have learned and have been able to adequately and care for our patients in extreme situations. Med-Surg and being here at Baptist has afforded me many opportunities. I do have, I was one of the first nurses in the system completing the WTA program, which is wound treatment assistant. That has since opened up a door for me to complete my wound ostomy certification at Emory, which has been done. I am a part of Emerging Nurse Leader. Like I said, the doors are constantly opened here, and being a part of the Med-Surg team has afforded me the opportunity to really grow and develop and really take that specialty to heart and care for our patients within our communities.
No, thank you, Gina. It sounds like you've been able to participate in so many of our programs, so I love to hear that. So definitely thank you for sharing. I know we also have Victoria on the line who can kind of speak to that experience. I know you're in your first year and started on a Med-Surg unit. So do you kind of want to share your experience about Med-Surg as a specialty?
Sure. So it really truly is. I mean, I know, whenever you're in nursing school, everyone's always like, oh, I want to do labor and delivery or ICU, or you want to work with peds. But no, everyone just sees Med-Surg as like, oh, I did that in nursing school clinical. I learned what I needed to learn. I'm done. That's all I needed. But I have to tell you, my first year, it's absolutely insane the amount of knowledge I have obtained and how much I've grown and how confident I feel. And at the same time, I feel like there's so much more to learn. You're constantly growing and learning more, and the patients, the different levels of acuity, it's always changing. We see so many different things. And with Med-Surg, just like other specialties, there are certain skills that we do that are more centered for our kind of a floor. I mean, I remember I had another floor call to ask how to do something as simple as like a soap sud enema. But for us, that's something we do, on a fairly regular basis. I mean, all floors have their own special things that they do, and as do we. So it is something that you see all the different systems of the body, as Lauren had mentioned earlier, and you really do get to focus, and it is a wonderful stepping stone. And whether you continue to grow in it and be like some of our great nurses we have that have been in it for 30 years, or you move on to be a manager like Lauren has, it really is a great way to learn your fundamental skills and grow from there.
No, it sounds like you're very passionate about it. So thank you for sharing those experiences. I also know, Amina, you and I had talked a little bit about your passion for Med-Surg nursing and how it's really set you up for success in your nursing career. Do you want to share a little bit more about that?
Sure. I actually started on a Med-Surg unit in Florida, and I'm new to the New Orleans area. I started at Baptist in May on 3 South, which it's a post-surgical unit. So I was able to use the Med-Surg skills that I learned in Florida to continue on with post-surgical care. We deal with ortho patients and a lot of plastic patients. And I've been able to learn skills that you don't just learn on a regular Med-Surg unit, like how to treat a breast flap, doing Q4 checks with that according to the doctor's order. But I've learned so much on 3 South. But Med-Surg as a whole is a foundational aspect of nursing. No matter which specialty you go into, Med-Surg is the foundation. That's where you, in my opinion, should start so that you can develop the skills to make you a good nurse and provide excellent patient care.
No, I love that. And that leads right into my next question, Amina, so thank you. I would definitely want to hear from McKeel. I know you said you started your career in Med-Surg nursing and you've grown into leadership. So tell me a little bit more about why Med-Surg is such a fantastic place to start your career.
Yes, I started in Med-Surg 23 years ago at Ochsner main campus on a Med-Surg floor. It was, I have to be honest, I was one of those new graduates who immediately wanted to go into a specialty. And my instructor told me, and she gave me the best advice of my career, which was to spend time in Med-Surg before I did anything else. And I listened, and I have no regrets. It has served me well. I did 3 years of Med-Surg, eventually transitioned to labor and delivery, went on to work in women's specialty surgical centers, and I drew from my Med-Surg experience every step of the way. What I found that once I got into the specialty areas, that my Med-Surg experience was even more valuable, because a lot of people who had not gone that route, they didn't have some of the skills that I had. So when they would have a patient who was out of the norm or had some comorbidities that they weren't used to seeing, they would always come to me because they know I had probably seen it on Med-Surg. So it's something that has served me well. It served me in leadership as far as how to work on a team, how to lead a team. It's all about teamwork. It's about, I know everybody talks about the time management and organization that you'll get on Med-Surg, but even more than that, it's how to work with people, how to recognize people's strengths and weaknesses, and how to draw upon those people and pull them out and get what you need at the time to get the work done. So it's been nothing but good for me.
Yes, no, I love to hear that. And I think it's really served you well. And we're super honored to have you leading one of our Med-Surg teams with that diverse background and foundation of Med-Surg. So I feel like that was a fantastic answer. I do want to go back to Victoria, since I know you are within the first year and a half of your nursing career, and you showed such a great passion for Med-Surg nursing. But at the time when you were making that decision, why did you choose Med-Surg as a place to start your nursing career? What really drove you to Med-Surg?
If I'm being honest, I, like McKeel, was not, and Lauren knows this, I actually initially thought I wanted to do labor and delivery, and I just happened to come across this job. And actually another nurse I graduated with, we both ended up getting jobs on the same unit, so it kind of worked out great. But honestly, no regrets ever. McKeel kind of touched on time management, and as a new grad, I really think that was one of the absolute hardest things to accomplish, especially for me personally. And earlier this year, and we're still having it, but fortunately, with Baptist, we are fairly back to normal. But with COVID and everything, it definitely threw a wrench in learning your time management. But it really took me a good 8 to 9 months to really feel confident in myself and getting everything. And actually, one of our nurses on our floor, she once made this really funny comment. She said that if you can be a waitress or a waiter, if you can work in customer service, and if you can handle those kind of jobs, you can be a nurse. Because that's essentially, out of all of the amazing things we do, that is also what we do. It is very stressful sometimes to be pulled in 50 different directions, and to have to sit there and prioritize and say, okay, what needs to come first, and what is life-threatening, and what should I do first. So it's definitely that in itself, I think, is a skill that just you can't teach. You can't learn that in nursing school. It really just takes experience, and working on a Med-Surg unit, having 5 patients like we usually do, that's essentially the only way to really learn that. And having that skill, I feel like if you can work and if you can handle this kind of a career lifestyle, to say, if you can do this, you can really do anything, because this will really build up yourself and your strength, and it'll get you to where you need to go, and it'll make you a superstar in what you do. So
Yes, I definitely agree. I think all of our nurses are superstars, heroes. You guys rock. I'm always super impressed with just the work that you do and how you care for patients and all of the things that you do for the system. It's just really incredible overall. So I appreciate that perspective, Victoria, especially pulling in COVID. And we're going to touch a little bit on that later. But I think it's really important in that first year, as you learn your time management skills. I'm sure you've developed a whole new set of skills in the past few months. So that's fantastic. So we heard from McKeel about her start in Med-Surg and how it has helped grow into leadership skills. I know that a lot of our leaders, specifically, our nursing leaders here at Ochsner Health System, have experience working in Med-Surg. I would love to know, as a leader and as a nurse, how did that foundation set you up for a successful career? And I want to start with Donna here as our Chief Nursing Officer of Ochsner Baptist. Tell me a little bit more about how that set you up for success.
Thanks, Morgan. First, I want to start off by saying, as Chief Nursing Officer and listening to Victoria and Mina talk, oh my God, it's warming my heart to have these young nurses that are so engaged and excited. I was that nurse 40 years ago, and I started as a nurse tech on Med-Surg. and I knew when I went into Med-Surg, I didn't know everything, and I wasn't going to know everything. And so what I did was, one of my favorite quotes, and I try to tell this to the new nurses that they start, is to be a sponge, to try and learn, listen, everything that you possibly can. I found a nurse that, there was a particular nurse on the unit, and to this day, we're still friends, that I mentored, or she mentored me, should I say. I admired her work ethic. I admired how smart she was, and I wanted to be like her. And I think my leadership saw that in me. And so within 2 years, I was a relief charge nurse. And from there, I knew that I wanted to lead. And what we do, especially here at Ochsner Baptist and within the Ochsner system, is we support our nurses that want to learn and they want to grow. There are many programs that we offer, and I think Lauren will probably get into that in a minute. Gina spoke about that. I mean, look at all we've done for Gina since she's been here, because Gina wanted to do it. On Med-Surg, you learn time management, as Victoria and Mina talked about. You learn the different diagnoses. I'm going to quote one of my best leaders around here, who's been in Med-Surg or been a leader for a long time, Joanne Cadera, our manager of nursing excellence. Joanne will tell you, meds, and don't y'all tell this to my ICU nurses, but a Med-Surg nurse can run circles around an ICU nurse because you have 5 patients. You can juggle 5 different diagnoses. They have 2 patients. And I was an ICU nurse, so I can't talk about him, right, Lauren? Because Lauren was one too. But you learn the time management, the development, the leadership. You learn how to lead. You learn about yourself. And we promote from within. Lauren was a promotion from within. McKeel was a promotion from within. Gina, to her OC position, was a promotion from within. We want to develop those that we see the leadership in. And I'm seeing Victoria and Amina might be my next 2. So that's kind of where you start.
Yeah, no, I love that. And yes, I definitely agree with you, Victoria and Amina. You guys are impressing me so much. I love having y'all a part of this and getting to know you through this process. But I kind of want to, pivot this question to Lauren, as Donna shared the opportunity to grow and develop into a leader. And I know that you've been able to do that over your career, starting your career here at Ochsner Baptist and then growing into leadership. You want to talk a little bit more about that and the programs you took advantage of?
Yes, absolutely. So as I spoke earlier, I've been a nurse for 9 years now. When I graduated from nursing school, I started my career right with Ochsner. I did start in critical care, but from that moment, I had mentors and leaders who saw those characteristics and traits in me that they wanted to nurture me to help me to learn and grow. I was very thankful for all of those leaders because they put me in Charge Nurse Academy. I remember my first shift by myself being a relief charge, being very nervous, but having those more experienced nurses who were like, okay, it's your turn, you can do this. We see this potential in you. From there, going to Emerging Nurse Leader program and graduating from there, and very excited about everything I learned, from the finances of how the departments run to getting more involved with scheduling and the hiring and interview process, and unit practice council committee, engagement committees, that really had me realize that I wanted to be a leader and I wanted to grow in this area. I'm now in my master's program, and cross fingers will graduate in May with my master's in healthcare administration, and that's also with tuition reimbursement. I'm able to go get my master's and get part of that paid for, which is very helpful. Continued on through my career here with Ochsner, and had involved in committees here at Baptist where just voicing my thoughts and opinions on how to improve a process got me to speak with someone and as a potential for this position. Went through the interview process, and the development and the classes I went through as a younger nurse progressing through my career here with Ochsner opened those doors for me to prepare me for this position. I'm very thankful. I've learned something new every day. You never know what's going to get thrown at you, but it's a family here, and there are so many people you can turn to ask questions. It's an environment that I really, truly love being a part of.
And congratulations on your master's. I know that you're probably ready for May to come, but great work on that. And I know it's very hard to juggle that and working full time and leading a team. So it's a huge accomplishment. You should be very proud of that. So I want to touch on what you said, though. It's a family here. You love Ochsner Baptist and the campus and the people you work with. I want to talk a little bit more specifically about the culture of Ochsner Baptist as well as the Med-Surg nursing unit. What specifically do you love about your campus? And Donna, I'd like you to take the lead on this, as I think you're a big part of setting the culture and setting the expectations for employees at your location.
Yeah, thanks, Morgan. I came back after Hurricane Katrina and was blessed to come back and help to rebuild. But even before Hurricane Katrina, we had a culture of inclusion, and it was a culture of kindness. So since we've been back after Hurricane Katrina, we've been able to carry that forward. We're kind of this big, small family. We're a big facility, but yet we're all close. We practice what we call 10-5, where we smile when we're 10 feet apart, and when we're 10 steps apart, when we're 5 steps apart, we greet. You'll see that. People come to our campus and they're amazed. They're amazed at how kind people are, because that's how we lead, with kindness and with caring. We're doing a lot of diversity and inclusion work right now. And, you know, with the state of the times, we have a diversity and inclusion committee that we are following with the system. And you'll find that that has helped to create that culture. We love taking care of our teams. We love celebrating. This coming week is Employee Engagement Week. We have a lot of celebrations. We have departments now that, and Lauren's department was a big part of it. I think it's her Employee Engagement Committee, where what they're doing is, instead of giving it to their unit, they're giving back to the other areas that help support them in their work, like security, like EVS. So I think when you look at us, we are just one big family, and that's the way we ride here, as they like to say.
No, I can definitely see that. And I love I would consider myself like a step relative of your family that sometimes gets to join and spend time with you guys. And I love it. So it's always great to see y'all. Now, I want to touch on the culture of kindness that you talked about, and how some of your areas are showing kindness to other departments and service lines within your campus. Lauren, you want to share a little bit more about that? I know you're taking up that initiative. Share with us.
Yes. So recently my team came to me with 2 really awesome ideas. We realized that we already have a strong teamwork on our unit. We are, Med-Surg as a family as a whole, but that teamwork is strong. And we realized we can't do our awesome job and take care of our patients like we should without the departments and the ancillary departments around us that support us to do an awesome job to take care of our patients. So we highlighted security and we highlighted EVS. So security comes on our unit, checks on us, we'll come in, how are y'all doing, do y'all need anything? If we need something urgently, they're there in an instant, make us feel safe. And so we recently provided their crews, they have 3 shifts. With one day we provided them pizza, we had cookies, we did a big glittered card. Victoria made the big glittered card. I still have glitter in my office from having it in there, but that, it was always about thanking those ancillary departments that help us feel safe and help us keep our unit running smoothly. We wouldn't be able to do it without them. And then for EVS week, we took 2 of our main consistent EVS employees who work with us, who keep our unit looking clean, and always, as I say, one of our employees riding on his float, cleaning the floors, and I feel like we need some beads to throw off of it. But we wanted to show them how appreciative we were for everything they do to keep our unit looking shiny and spotless, and we wouldn't be able to do the amazing care we do without those ancillary departments. So instead of doing kind of things within our unit, we're expanding outside of our unit to show that we're appreciative and they're a part of our unit. Yes, they work in a different department, but they're really, truly a part of our Med-Surg team.
No, I love that. And I love the celebration of other staff members that help care for patients. I think that's fantastic that y'all have taken the initiative and y'all are helping create that culture of kindness. Amina, I want to jump to you. I know that you're one of the newest members of the team joining us on the call. So I'd love to get your perspective about the culture at Baptist and on the unit that you work on.
I feel that 3 South and Ochsner Baptist as a whole, it's a team environment. McKeel is my manager, and I feel that anytime that I have a question or, I need, some advice on anything, she is definitely there. She's available for me to talk to, as well as the other leaders on our unit, our OCs. But Ochsner Baptist as a whole, I mean, we have access to great leaders like Donna and the other leaders. I mean, everybody is accessible. They, they welcome questions or, anything that would help improve our unit, because our common goal is patient care. So I feel like because everybody has that common goal, everything flows.
Yeah, I love that. For sure. And I think, keeping patient care first is one of our Ochsner core values. So I love to hear you share that and keep it top of mind. I also want to ask this question to Victoria. I love to get a lot of people's input on this one because I think the culture is so important and something that makes Baptist so special. And so Victoria, you want to share the story that you told me about your first few days at the Baptist location?
I think this is probably my favorite question to answer. Okay, so it was my very first day, or maybe it was when I shadow shifted. I don't remember. But Lauren actually walked me around and showed me around the hospital. And everywhere we went, I was so shocked because everywhere we went, she knew someone. She knew their name. They knew her name. It was so crazy to me because this place, which now seems so small, seems so ginormous at the time. And it was just so special. And now, now that I'm a year and a half into, commitment to this place, to Baptist, I go around, I see Mike from transport or Miss B. She's one of our employees that works in dietary. You see him and you say, hey, and it really is just a big family. It's nice because it's a small town. It feels like a small town hospital where you get that family environment, but you have the support of a big corporation like Ochsner, which is just the best thing in the world. And even on our unit, unfortunately, just in life, there's going to be days that are harder than others. And, there have been so many times, even yesterday, when I was just sitting there and I guess I just looked really stressed out because my charge nurse came up to me and she was like, all right, what do you need me to do? Who do I need to give meds to? What do I need to do for you? It's I didn't even have to say anything. Just the teamwork is there. People know. They're they don't even ask. It's not even a question. It's just, let me help. Even Lauren, our manager, she takes time away from her busy schedule and all her meetings and all the other things she has to do. All the time she comes on our floor and she's like, okay, who needs what? What can I do? Are you good? She goes around and asks every single person on the floor, what do you need? How can I help? Before she leaves and goes back to her doing whatever she does. So I'm getting shaky. It's just so, the passion and for teamwork and just support is so there. And oh gosh, I'm gonna cry. I wouldn't have made it through this first year. I'm so sorry.
No, that's okay. I feel like you're gonna make me tear up because it's very obvious that you
Victoria
experience.
We love you, Victoria. We're so proud of you.
Yeah, you definitely, Victoria. Yeah. I think that's why we all do what we do here and why we're on this type of talent talk. We want to share this with the community, just how incredible the team is. And it's so obvious to see just in how you guys connect with each other and all of the great stories that we're sharing. So I love to see that. Do you kind of want to a little bit and talk more? We talked about the great culture, but I know that this culture has gone through definitely some transformative months in light of recent events with COVID-19 and the impact that that has made on caring for patients, you know, and our frontline staff. So I really want to talk a little bit more about the organization's response to COVID-19, where we were 6 months ago and where we are now, and some of the ways that we have supported our staff and our patients during that time. So Donna, you want to talk a little bit about Ochsner Baptist and our current status with COVID-19?
Sure. Well, first off, we can't hug with COVID-19, but Victoria, I want to give you a big hug right now. That was very, very sweet and very genuine, very, very genuine. So, you know, March 12th was the first day that we actually diagnosed our first COVID patient. Actually, we diagnosed 2 patients on that day. And from that day on, for the next month or two, we were very heavily inundated with really sick COVID patients. And at that point, everything stopped. I mean, we could not, you know, we stopped doing clinic visits, we stopped doing surgeries because our focus had to be on being able to accommodate these patients who were extremely sick. And with that came practices that I've been a nurse for 40 years. Never once did I think I would see a pandemic. We talked about it a lot, and here it was. The great thing about our team, about Baptist, and then about the system itself, being part of the Ochsner system, is we all came together, and our priorities were being able to care for these patients, but also keeping our employees safe. We never went without PPE. We had personal protective equipment at all times. We never ran out of a respirator/ventilator, as people refer to it. Even though you heard that in the media, that never happened here. We have an extremely, extremely engaged and competent supply chain within this system to where we had everything that we needed. And then our local materials management set up processes. But what happened specifically during this time when we had to shut down procedural areas, that staff came and helped. We redeployed them to other units. And, you know, we had outpatient surgery nurses that were doing, that were on the Med-Surg units, supporting the Med-Surg nurses as scribes. They took a crash course in the computer, as well as we had pain management nurses that were working down in the emergency department. The bonds that were formed between the 2 groups of staff are bonds that are going to last forever. And it was great to see. It was very heartwarming. Since then, our system took a strategy where we decided that the best thing was to be able to cohort these patients in areas that they could provide the care, and then have areas where, as we all know, during COVID, we had a lot of patients that didn't reach out to receive care because they were afraid. They were afraid to go into a hospital that had COVID patients. And so with us being the Center of Excellence for Women's Services, the decision was made that our hospital and our hospital in Hancock County, Mississippi, were going to be what we call COVID light. And the reason we say COVID light is because, so we will still have COVID patients that come into the emergency department. If they test positive for COVID-19, we will transfer them to another facility. We stay COVID light because we are the Center of Excellence for Women's Services. So when a mom comes in, and we do have moms that are asymptomatic COVID positive, when a mom comes in and tests positive for COVID, we will still deliver the baby here. We will care for her and the baby on our women's unit. So that's why we call it COVID light. But that's what our facility is. So any COVID patients that come into the ED, we transfer out, but we still take care of our women and children that would come in with a COVID diagnosis. So it really brought the system together. It brought our facility together, and I'm proud of the work that we did.
Yeah, absolutely. The work has been phenomenal and just so incredible to see, especially when we talk about redeployment. I think that was just such a special thing to see our staff and our teams coming together to do what needed to be done for the patient. So Lauren, I want to talk a little bit more about that because I know you were one of the units that had a lot of redeployed staff and had to get creative around staffing to support patients. You want to talk a little bit about your experience?
Sure. So back in March, April, when we were having high numbers of COVID cases, our unit was, the COVID unit. I have to say I am extremely proud of the teamwork and the compassion and empathy my team showed in taking care of these very sick patients. I'm not sure if it was divine intervention or just, I don't think we saw this coming, but the month prior to COVID's outbreak, we had a respiratory skills fair that covered all the different type of oxygen delivery devices, BiPAP, assessments, really fine-tuning those breath sounds to help with our nurses to develop those skills. Like I said, I'm not sure if it was divine intervention, but the month later, COVID broke out. No one obviously could see this coming. So in that moment, we had people who needed to work. They still needed to provide for their families. And we had same-day surgery nurses on our unit. We had surgical techs on our unit. And we did a quick EPIC class for those same-day surgery nurses. They were able to act as scribes for our nurses to help with the in and out of the room. The nurse could go in the room, deliver her medications, do her head-to-toe assessment, and call out her assessment to the nurse standing in the doorway to help. They could be there to deliver anything they need, because once you get all the PPE on, it's time-consuming to don and doff it the correct way and the safe way. So we practiced and piloted the scribe use to see if it would help to have someone documenting. When I first piloted it with the team, we had 9 assessments and all 9 sets of medications administered within an hour and a half, which I think is a record time for a med-surg nurse. But we were very proud of that. It just showed that teamwork and strengthened our teamwork even more. Another thing, something as simple as like a warm meal. All of our trays were delivered on isolation trays, so they didn't keep their temperature very well. So we would be heating them up for the patient. So when that nurse went into the room, the patient had a warm meal. You already don't feel well, so that warm meal was just something so little that meant so much to those patients. And so something so simple as helping us heat up food, we were so extremely thankful for that. People coming around the unit to wipe down our high-touch surfaces, so extremely thankful for that. It was the entire hospital coming together to really help us run more efficiently and take the best care we could of those patients.
Yeah, and I think that's incredible. And I'm just so proud to hear of the teamwork and the creativity, as well as just the leadership directive during that time to get, our patients into the best place they could be and care for them, especially at a time that's really scary where you have to be in the hospital alone. So just really, I appreciate you guys sharing that. I know it is such a critical topic that we need to cover, right? Because it relates to all of our nursing staff, but it was really great feedback. So I really appreciate that. So now I want to talk a little bit about, we've covered a lot about the culture of the organization, as well as the Baptist campus specifically, and all of the great resources for nursing. But I think it's important to kind of pick back up on some of the things that Donna was sharing around diversity and inclusion. Earlier this year, so in February of 2020, we have added a chief diversity officer of Ochsner Health. That's Deborah Grimes, and she's been a fantastic addition to the organization. And I want to talk a little bit more about some of the diversity, inclusion, and equity initiatives the system has put into place and how we see this growing over the next year. Mikhail, you want to talk a little bit more about your experience with diversity and inclusion here at Ochsner Health?
Yes, as a woman of color, I have never been more proud to work for any organization. Ochsner blew me away with their courageous and bold and quick response to the issues that were affecting our society. They truly, I came to work the next day with a pep in my step after Ochsner sent out a complete statement to the entire organization on its stance. And it's been so much more than just words. Like they really have been putting action behind what they have said. And Deborah Grimes and her team are doing a phenomenal job at a system level of rolling out initiatives. I know one of the things is that, diversity training, cultural bias training will be a requirement for all employees, which I think is phenomenal. I know that there's talk of recruitment of expanding diversity recruitment in leadership, which I think is awesome. Partnering with some of the historically Black colleges and universities. I am so proud, especially of Baptist. Baptist, our CEO is passionate about this topic. And so she has started a Baptist-specific diversity and inclusion council, of which I'm a member. And we have some exciting things in the works for Baptist, some things involving community outreach, some things involving education, and some things in internal networking. And I just see that this is an opportunity to create a workplace that is a true reflection of the community that we serve. Our own CNO, Donna Martin, and our leadership council, we do have diversity every time we have a diversity topic on diversity and inclusion. We are assigned TED Talks, and we kind of talk about the things and just openly have discussions and conversations to get everybody talking about it. So I think I'm just so appreciative of Ochsner and Baptist specifically in this area.
Yeah, no, absolutely. And we appreciate you and your teams working through, diversity and inclusion topics, making sure that you're spreading training to your staff, as well as giving them opportunities. I love that you said, networking, working with historically Black colleges, universities. Those are some great initiatives, and we're just so excited to see it grow over the next year. So definitely thank you for all of your support of that and being a leader in that area. So I feel like we've covered tons of great things about the Baptist campus, specifically our Med-Surg nurses. You guys, it's so obvious that you are family. And I think we've just had such a great session, and I'm loving to hear from all. I feel like I teared up a little bit earlier. But I want to turn to Courtney, who definitely, you're a major part of this Baptist team and a big part of the family. So Courtney, I know that you can tell us a little bit more about current opportunities, how someone can join this great team, as well as what are some of the benefits of coming on board here at Ochsner Baptist on one of our Med-Surg units?
Absolutely. So we have day and night positions available on both units. So you can check those out on our career site at www.ochsner.org/careers. We'll also have a link directly to these Med-Surg opportunities here in the comments or in the post too. So that way you can get some details there and apply directly. And then after you apply, you'll get connected with a recruiter here who can talk to you just about the benefits of working at Baptist, working on these units. It'll probably be me. And then I did kind of want to highlight too, it's such a great time to join the team. We've got some additional lifestyle benefits on top of our already great benefits packages here. So we've got those rolling out in 2021. And like Lauren mentioned, we do offer some tuition assistance. So we do offer that for our employees to continue education, but also to help reimburse some to be on the unit and take advantage of those. So when you talk to a recruiter, ask about those additional perks. We're happy to answer.
Yes, absolutely. And I think specifically, tuition assistance and then student loan reimbursement are fantastic incentives for anyone just starting their career and kind of needing some support in that area. I think that's fantastic to point that out, Courtney. So thank you. I think that's all of the questions I had. I feel like we've had a great discussion. I definitely want to thank all of our panelists for being a part of today's session and our talent talk. I have learned something new, and I hope everyone tuning in did as well. And now we all just want to go be a part of the Baptist family because it is so special. And again, just want to thank you guys for just being so honest and open today. This was a fantastic session. And for anyone that's interested in learning more about career opportunities at Ochsner Baptist, as Courtney mentioned, you can go to ochsner.org/careers and check out our career site. There are lots of great resources there for you. Another great place to connect with us is on our social media pages. So if you're tuning in on Facebook, you're already part of our careers Facebook page, but I definitely want to recommend that. It's Ochsner Careers, our LinkedIn page for Ochsner Health. So again, great resources to connect with us and be a part of these continuing virtual sessions where you can learn more about the organization. Just want to thank you, everyone.